Dr. Ali Fakhimi from Soft Touch Dental. How are you?
I'm doing great, thank you. How are you?
I'm so good. I'm so glad that you're here today.
Thank you for having me.
We got to spend some time with you and your practice and your staff when we were filming the TV segment, so we're really excited that it's going to be rolling out next Thursday. But I want to talk to you, before we kind of dive into that, I want to talk to you about your story. You're celebrating 20 years in business, your anniversary.
Yes.
But you were in the construction business with your father, and then that led you to dentistry. How did that happen?
Well, I always loved working with my hands as a child, and getting into construction with my father, it's very related. You know, we started with the foundation of the houses, foundation of buildings, which translated to the foundation of the teeth. I started working with our family dentist. I loved the medical and the science field, and I took a fascination with dentistry by working with our family dentist for a while. And after I worked with them for a few months, then I took a job in a dental laboratory, saw that I loved the work and what it has to offer, and next thing I know, I'm in dental school, and that's where I'm at.
And it's 20 years later, and you're having a celebration. I love that. Well, and then what do you think separates you? Because I've seen a lot of dental practices, but you guys are very different. What would you say the differences are between you and other dental practices?
Well, we are a comprehensive dental practice. We look at a holistic approach to every patient. We don't just look at one tooth here, one tooth there, and have the patient come back. When a patient comes in to see us, we evaluate the entire mouth to see what all their problems are and start prioritizing for every patient. We don't really refer out too much to any other practices for any kind of specialty work. We do everything in our own office.
That's amazing, because I know in the past, experiences I've had, I've gotten outsourced out for other things. So it's really nice that you guys do that in-house. I love that. So you made some major adjustments to your scheduling recently. You've also done an amazing renovation. I mean, blown away by your practice.
Right.
It's absolutely gorgeous. So talk to us a little bit about the changes that you've made.
Well, we started this renovation well before the pandemic. We started it over a year ago. We wanted to renovate our entire office to give more patient comfort. We took the roof of our building off, raised the ceiling, put all new ventilation system in. We privatized every single exam room that we have. We have glass doors everywhere to give the patients the privacy that they need. The airflow in each exam room was very important to us, and we maintained that. We have aromatherapy that's blowing through the entire office, because nobody likes the smell of a dental office, and that was the number one thing that we wanted to get rid of. And we just wanted a nice atmosphere. We put the latest technology chairs in. We put all the new equipment, the best instruments, which makes us more efficient for the patients, and we can spend more quality time with the patients when we're more efficient.
I love that. It's gorgeous. And you did the decor yourself.
Yes.
You have to tell us that.
Absolutely.
Yeah, I mean, that's a big thing. I mean, he's got a really great eye. If you have to see this place. I know we're running some B-roll of it as well, but it's spectacular. We were blown away. And so I also want to ask you, because you are in a highly competitive profession.
Yes.
Dentists, I mean, there's a lot of dentists out there. You're very boutique oriented. So let's talk about like the culture that you have at your place as opposed to, I think, other dental offices. And you really strive yourself on having a culture in your office.
Yes. Our biggest concern for patients is the continuity of care. There are a lot of patients out there, or a lot of practices out there, that are like a corporate dental offices. They have hundreds of dental offices, and you don't ever see the same doctor and the same dentist ever again. All of our employees have been with us minimum of 10 plus years. And when a patient walks into the door, we know them by the first name, we know their habits, we know what they like, what they don't like, what they prefer. And that's very important for the patient comfort as soon as they walk in through the door. And we know their history with their dental work. So when they come in and they say they have an issue, we already basically know about it.
So what can they expect when they come in to see you? Like, what's the process of how things would work?
So now with the COVID-19, when a patient makes an appointment, we instruct them, they're going to call us as soon as they arrive in the parking lot. We do not want any cross paths between a patient exiting the office and one entering. One is going to exit, and they text or call us, and as soon as it's clear in the waiting room, we have them come in and we guide them right back to their exam room. And that's how we get the efficiency going.
And then your shield, right? You have the shield today.
We had these shields. We actually have been using these shields all along. So all of the PPE supplies that are being passed around now for COVID-19, we've been using all along anyway. And the only thing that we really did was just put the plexiglass barriers up for the protection of our staff as well as for the patients when they walk in at our reception desk. We do the gowns, the shoe covers. The only thing we really added were basically the shoe covers, but we were still wearing the gowns as well.
I love that. And Cheryl's great, right? Your office manager. We got to talk to her. She'll take care of you. And if there's certain insurance or if you have questions, right? She can help answer.
Cheryl is a gem. She can answer any questions for you and help every patient out with their finances, with their insurance, everything.
Well, and I do want to mention too, because you and I talked about this, you have clients that are flying in from out of state. That's how great you are. I mean, I love that. It says a lot about you, and they're consistent clients. So let's talk a little bit about that.
It was very flattering. We had a patient about 6 or 8 months ago that found me online and made an appointment, walked in, and after having a conversation with him, he needed a full mouth rehabilitation. So we had to take out most of his teeth that were not savable and gave him implants. And after talking to him for a while and found out that he's here from St. Louis, Missouri, that he flew here for a consultation from St. Louis, Missouri. And I was blown away with that. I was very flattered.
Because he was told you couldn't do that, right?
Right. He's went to several dentists in St. Louis, and everyone told him that you're going to go to dentures. You're not going to be able to have natural looking teeth as you did before.
It says a lot. I love that. So, okay, so let's talk about some promotions that you're offering right now, because I think they're amazing. I know that you've got a few different things. I know one of them that I really thought was interesting was the dental implant special.
Yes, we have a dental implant special right now for the implant, the abutment, and the crown. We have it for $17.99. And it's very competitive price for this type of a procedure. And it's very simple. Implants are very, very simple. A lot of people are getting scared of it, but when it's done, it's the anticipation that bothered them more than the actual process.
Well, and you have to tell everybody about the crown, because we saw that at your location, that you can make that crown so quickly.
Yes. So one of the efficiencies that we added for our technology for the office, we do a same-day crown. Patient comes in the conventional method, we would have to take a mold of their teeth, send that out to a lab. A few weeks later, they would come back and get that crown. Today, in a couple hours, we prep the crown and make it right there and deliver it. They don't walk out with any temporary or any gooey impression material in their mouth.
So amazing. I love the technology. So let's talk about the all-on-4 procedure, right? Because that's a full day thing that you do. And I know you've got some samples with you today.
Yes. This is the all-on-4 procedure. Let's say if a patient comes in, they are edentulous, they don't have any teeth, and they're tired of wearing dentures. And if their bone is sufficient, we place 4 implants in the same visit. We make this bridge, and it screws onto the implants. They walk out with a fixed prosthetic, like their own natural teeth, in one day.
Wow.
Yeah, it's amazing.
So that's something that, what would somebody do? Would they come in and sort of like talk to you about the procedure first? I mean, how does that work?
Yes, they're going to come in for a consultation. We're going to take a CT scan of their mouth to see how much bone they have, what's best for them, talk about what their goals are. Then we take a scan of their mouth, send that out to our lab. We're going to have this bridge fabricated beforehand, before the surgery. On the day of the surgery, they come in, we start the process, put the 4 implants in, and fabricate this bridge to those implants that we placed in their mouth.
Would you say this is a specialty?
This is a very high specialty, yes.
Okay, that you guys provide. I love that.
Right.
So let's talk about some other things, because you do Invisalign, right? To straighten teeth.
Yes, and that is why we're a holistic dental practice. We address most of these issues. We do a full mouth reconstruction. We can either do veneers, full mouth crowns. We can do braces. There are different types of braces. We do Invisalign as well as the implants.
And teeth whitening.
Yes.
Which everybody needs, the Zoom, right?
Correct.
I love that. So you can find all of this on their website as well. We'll have all the links up for that. And then I just wanted to ask you, I mean, what do you love about your job? Because I know you're so passionate about what you do.
Yes. The reward of changing someone's life is, I don't know how to describe that. When a patient comes in here, just like this gentleman that came in here from St. Louis, Missouri, every time he comes in, he says, I just want to hug you and kiss you because you don't know what it did for me. I wasn't able to eat what I wanted to eat. I wasn't able to smile. And that's very rewarding. You know, it's nothing I can really put into words. It's just a feeling you get.
It's very fulfilling. Well, the other thing is, what would you tell the viewers when they're picking a dentist, right? What should they be looking for? Is there anything that they can do?
Well, first you have to be comfortable with the dentist you're going to. I may not be the perfect dentist for everybody. So go talk to them, sit down, see if you like them, see if you trust them, look at their credentials, look at their training, see what they specialize in, see what they have to offer, and see if they meet your goals and how attentive they are to you.
I love that. Well, we're so excited. We can't wait for this TV segment to air, you guys. It's going to be airing July 2nd and July 9th on Channel 4 at 4 p.m. We're going to take you inside. We're going to sit down, show you everything. So we're really excited about that.
Thank you.
And I'm glad you were here today to kick this off and to educate our viewers. I think it's really important. Thank you so much for being here.
Thank you very much for having me.